So you'll find, ladies and gentlemen, as in a lot of practices in South Africa, you find situations where film-based radiographs are essentially digitized or viewed on computers in the same way as any other document. So thanks to technology, we have situations where desktop scanners capture and digitize the light signal of whatever is placed inside of them. So this process is essentially similar to placing a film on a duplicator light box that we just mentioned earlier on. So this type of indirect digital imaging is slightly less detailed as opposed to direct digital imaging, because the resultant image is similar to a copy of the image that we received during or upon exposure. So from there, most computer software programs that are used in digital imaging are capable of performing electronic imaging enhancement. We may use this enhancement in situations where we want to see or view a particular area or particular region of a tooth or teeth in much more detail, in greater magnification. So in such situations, we would then make use of electronic imaging enhancement just to make sure that our diagnosis is correct, so that we can then manage the patient in a more correct fashion. So that's why we then basically make use of our electronic imaging enhancement. But then we have other variables that we may want to correct or change or improve on as we are basically enhancing our image. So you can actually adjust for contrast, brightness, in terms of the radiopacity or radiolucency of an X-ray, the image size. We may want to zoom, especially when it comes to periapically, because if you make a mistake, that's essentially the difference between just a normal restoration versus an endodontic procedure. We may want to improve the sharpness of an image. So for example, we want to maybe see or perfect like the severity of the caries on a particular tooth. We'd want to maybe perform inversion, so either white to black or black to white onto our X-ray, like I said, especially for purposes of viewing caries, even our periodontal ligament spaces. And then from there, we can even perform pseudo color alteration, because some people struggle visualizing certain images with a certain color, so they make use of other colors or pseudo colors just to help improve the image for better diagnosis and therefore better treatment planning for the patient, because that's essentially what we want to get to at the end of the day. So that is it, ladies and gentlemen, when it comes to digital imaging. Nice, short and sweet. So all in all, what can I say about what we've learned today? So we've learned that with digital radiography, we do not say we took an X-ray. We say we rather took a digital image of the tooth or teeth of interest. From there, we have a situation where now from there we'd want to discuss what we'll do, or how we go about taking these digital images. So with one instance, which is with our direct image, we essentially take an X-ray, and then the X-ray it has a silicone chip that is sensitive. Then it makes use of a CCD that essentially converts X-rays to electrons. Electrons are then stored as pixels, and then from there, upon exposure, electron charges are then converted to form a digital image. So that's what happens with direct imaging. With indirect imaging, we have thin flexible plates that contain phosphor crystals, similar as with our X-ray images, and then from there we create a latent image. This latent image then requires us to then expose it from there into a scanner, which then processes this technology into a film, and then thereafter we have to make use of a light box to actually clear our plates of the image that we had just taken beforehand. Both of them, ladies and gentlemen, with digital as well as film, strict infection control procedures must be adhered to. This would be making use of a barrier envelope or a transparent, how can I say this, a transparent paper, just to actually conceal our sensors or our receptors, because we will be making use of them again and again and again. So that's essentially what happens with digital imaging. I hope you guys understood that. If you have any questions for me, please do not hesitate to ask me anything. Advantages and disadvantages you can think for yourself, but obviously with indirect digital imaging, the main issue is there are lots of steps you have to actually go outside of the room, wait for the plate to get processed for us to get an image, and then from there, sensitivity of handling in that you have to make sure that you do not get any scratches or dust onto your plates, and then from there making sure that they always are placed into our light box so that our image is then removed so that the plate can be used again. So that's like more minutes in the chair, more minutes of working time for you as the dental assistant. So that's the main disadvantage with direct digital imaging. Whereas with direct imaging, obviously, the main disadvantage would be the fact that we have a cord that we have to consider that is easily prone to damage because it bends so many times between the maxillary arch and the mandibular arch when we're taking x-rays. It is very sensitive, and then from there it is very uncomfortable for the patient. The main advantages of it obviously would then be that after taking our image, that are electrons that are then transmitted to our computer software. It appears within seconds onto our computer system. It allows for ease of manipulation in terms of image enhancement on our computer software, and it is easily storable onto our computer software. So those are some of the issues that you will find. We must also remember that indirect digital imaging essentially works the same as our conventional X-ray film. The only difference is these thin flexible plates have a layer of phosphor, whereas with our conventional X-ray film, the film is then exposed to our silver halide crystals that cause a latent image that needs to be developed into the final X-ray film that we see. So that's essentially the difference between the two of them. I hope you understand this. I hope it makes sense. You will be seeing quite a number of these different systems in different practices. Obviously, direct imaging being more expensive as opposed to our conventional X-ray film, as well as indirect digital imaging solutions. But those are some of the things that you will encounter. And then from there, you will find sometimes that after taking an X-ray, you'll have to basically make use of the computer software systems to actually make alterations or enhancements onto your X-ray so that we get the best possible image without actually exposing the patient again to radiation. So some of these enhancements will include correcting or adjusting for density and contrast, digital subtraction, embossing the picture, magnifying the picture if necessary, making use of measuring tools such as with endodontic treatments if that is necessary for a patient, reversing the grayscale so that we can actually try and get a good diagnosis of a particular tooth or teeth, as well as then making use of side-by-side displays of images. So those are some of the things that we may be able to do or manipulate with direct imaging systems, as well as their associated computer systems. So those are some of the things that you'll be practicing and encounter in private practice. So please just understand what is happening with digital imaging, how it works, how we get to that final image. I think we've explained that in our lecture already, but if you have any questions, do not hesitate to contact me either via email or under our presentations. Okay, bye guys.